Imagine navigating life with an invisible condition, a neurological phantom causing seizures without warning. Sam's story, coming up in our next video, unveils this complex journey. Sam, diagnosed with psychogenic non-epileptic seizures 2 years ago, has faced challenges that are as real as they are unseen. His tale isn't just about struggle, it's about resilience, about coping, about hope. It underscores the importance of a community that supports, understands, and empowers. Subscribe and join our community to not only hear Sam's story, but also to empower each other through knowledge. What if I told you not all seizures are caused by epilepsy? Welcome to the perplexing world of psychogenic non-epileptic seizures. PNES is an intriguing condition that brilliantly mimics epilepsy, yet is driven by psychological factors rather than neurological abnormalities. It's a bit like a chameleon blending into the epilepsy landscape, making it quite challenging to diagnose and understand. But let's unravel this mystery together, shall we? Picture this. Your brain is a vast, intricate network of electrical circuits. In epilepsy, these circuits misfire, causing seizures. But in PNES, the circuits are functioning normally. Instead, the seizures manifest due to psychological stressors, like a mind-body distress signal. So, what triggers PNES? Well, it's often linked to psychological trauma or stress. This could be anything from a car accident to a painful breakup or even ongoing work stress. The brain, in its remarkable complexity, reacts to these stresses by triggering a seizure. It's important to note, though, that PNES is not a made-up condition. The seizures are not deliberate or consciously controlled. They are the brain's unconscious response to stress or trauma, a bit like a psychological defense mechanism gone haywire. That's the thing about PNES. It's a testament to the intricate connection between our minds and bodies, a reminder of how psychological distress can manifest physically. While the seizures are not caused by abnormal brain activity, the distress they cause is very real. The first step towards managing any condition lies in recognizing its signs, and so it is with psychogenic non-epileptic seizures, also known as PNES. Understanding the symptoms of PNES is crucial. They can be quite complex and often mimic those of epileptic seizures, which can lead to misdiagnosis. The symptoms may differ from person to person, but they typically include convulsions, loss of awareness, and even periods of unresponsiveness. Some people may experience trembling, rapid heart rate, or feelings of fear and anxiety. However, there are certain characteristics that can help differentiate PNES from epileptic seizures. For instance, during a PNES event, people often have their eyes closed, which is less common in epileptic seizures. Additionally, PNES events can last significantly longer than most epileptic seizures and do not respond to traditional seizure medications. Misdiagnosis can lead to unnecessary treatments, which not only fail to alleviate the symptoms of PNES, but can also cause further psychological harm. It's a common misconception that PNES is just all in the mind. However, these seizures are real and they're certainly not under the person's control. They are a physical manifestation of psychological distress. Understanding these differences and recognizing the signs of PNES is the first step towards a correct diagnosis. It's essential to consult with medical professionals who are knowledgeable about this condition, as they can guide you on the path to effective treatment. Knowledge of these symptoms can pave the way for correct diagnosis and ultimately effective treatment. With PNES, the journey to recovery often involves more than just medication. It's a path that requires an arsenal of tools and strategies to successfully navigate. One of the key players in this journey is cognitive behavioral therapy, or CBT for short. This form of psychotherapy helps individuals understand how their thoughts and feelings influence their behavior. It's about equipping people with the skills to manage their symptoms and improve their quality of life. Then, there are mindfulness-based therapies. These approaches encourage individuals to focus on their present experiences in a non-judgmental and accepting way. It's about fostering a sense of calm and control, even in the face of the unpredictable nature of PNES. And let's not forget about other psychological interventions like stress management or relaxation techniques. These can be invaluable tools in the PNES journey, helping to alleviate some of the emotional and physical stress that can trigger seizures. But here's the thing. There isn't a one-size-fits-all approach to PNES. What works for one person might not work for another. That's why it's so important to have a personalized treatment plan tailored to an individual's unique needs and circumstances. Remember, every step taken towards understanding PNES is a step towards empowerment. Subscribe for more insights and join us in our next video where Sam shares his personal journey with PNES.